Dr. Eggy is an infectious disease specialist at OHSU. She got her undergraduate degree in bioengineering at UW, her MD at LSU Health Sciences. She did her internal residency at LSU Health Sciences and her fellowship at Anderson Cancer Center. The most common parasite that Dr. Eggy has found in Oregon is Cryptosporosum and Giardia.
We have had outbreaks, particularly, you've probably heard about this in the tap water supplies here in the Portland area, of Cryptosporidium. And then, hikers commonly get Giardia. We generally think of it more like in the mountains and streams. This is like a very textbook. I haven't seen a case in Portland, but I would imagine it's not uncommon amongst people who see outpatient.
Crypto infects humans similarly to Giardia. Once in a human, it undergoes a complex life cycle in the human digestive tract, where it can undergo sexual reproduction, asexual reproduction, and it can also cause autoinfections. Some of the common symptoms of Cryptosporosum are GI problems like stomach cramps, diarrhea, nausea, and vomiting. Giardia creates similar GI problems.
The presentation, there's rarely fever. It's usually just GI symptoms. Both of those organisms do not cause a particularly severe disease process in people with a good immune system. And so arguably people might recover without treatment. But Giardia can lead to a lot of flatulence and abdominal pain and really fatty loose stools. And so people generally will seek care because it's just kind of unbearable.
Although both Giardia and Crypto can resolve themselves, sometimes treatments are sought for discomfort and in immunocompromised patients and even patients with HIV. The treatment for Cryptosporosum is nitazoxanide. Nitazoxanide stops the growth of protozoans.
Cryptosporidium can be particularly problematic amongst patients with HIV. So that's where you'll usually see treatment activated more so than your general patient. And then so it's mostly a self-limiting disease. Giardia we were using metronidazole, which is an anaerobic drug. But we've now started using I can never say this. Let me say it. Let me type it out so I can say it. Tinidazole. More so, I think it's a little bit easier on the stomach. And I think we get a little bit better activity, particularly, again, amongst the immunocompromised host. We have more reliant.
Giardia and Crypto are both found in standing water reservoirs. Giardia has a pretty simple life cycle where it infects the humans when it's a cyst, when a human drinks contaminated water. The human then sheds the parasite through their stool.
So people, commonly will ingest the parasite. That's how you generally get sick. I've never had a case where someone has denied that. Although I presume if you touch running water and you aren't careful to wash your hands, you could get a low dose inoculum if you're particularly susceptible. My dog definitely got it from drinking standing water back when she had it when she was a puppy. Crypto, again, I think I said it's usually found in broad water reservoirs. Again, I think so for most of our parasites, you'll see a theme of some animal feces or human feces, fecal oral, at least for the ones that present with diarrheal illness, that's what you'll see.
On the other hand, the most common infections that Dr. Eggy found in Texas were Strongyloides and Acantha amoeba. Strongyloides is found in the soil and infects humans from walking around barefoot. It creates an array of diverse symptoms due to the tracheal migration. It mainly causes GI symptoms. The treatment for Strongyloides is oral ivermectin.
But there's a particular prevalence of things that we don't really think of often. So I had seen quite a few cases of neurocysticercosis. It's tinea solium. That is a helminth infection, but I never think of it like that because the presentation is you see the cysts within the brain of the parasite in almost like an egg form, and then those rupture. And that's how people get really significant symptoms with like pressure in the brain, and they start having visual disturbances or lethargy. Seizures is a common presentation. But I used to see that quite a bit because that is transmitted most commonly agriculturally from exposure to eggs within pig feces. And then the eggs can sometimes be within the musculature of the pig. And so, like, if people eat raw meat from, like, pork meat, they can get infected with Tinea solium.
Encantha amoeba is an amoeba that infects humans typically through a neti pot. Copious amount of people do not wash their neti pots or use hot water or microwave the water before using it. This causes a high inoculum to be sent straight to the brain.
Acantha amoeba I saw quite a bit in Houston for whatever reason. People use neti pots a lot. Do you know what a neti pot is? It's like for sinus rinses. Mm-hmm. And if you read the neti pot, it'll tell you to use like purified water or microwave. And the basis for that is because by putting a high inoculum of water into your nose from the tap water, you could introduce something like one of these parasites. And so I've seen this. I have had one case where the patient actually had potential meningitis symptoms, and so that was in Houston. It was a diabetic, immunocompromised, not very well controlled, and she was, I believe, I'm trying to remember if she had any. I don't think she did have transplant history, but we frequently do see it with transplant, where they get these really large eschar lesions on their skin, and sometimes that's a telling sign that you have acantha amoeba, so like these round, black, kind of necrotic skin lesions. And it can be pretty disseminated in patients that have poor immunity. The other parasite that I saw in the South that I hope to never see here, although it's been moving to colder places because of climate change, is Naegleria fowleri. So I don't know if you know the brain-eating amoeba. We have a case down south maybe once every couple of years, and obviously it's very devastating.
Amoebas that infect the brain create amoebic meningitis, which is incredibly difficult to treat. The treatment that has worked the best is amphotericin and methylphysacin.
That presents really with meningitis. It's called amoebic meningitis, so kind of a gradual progression, or kind of rapid but gradual progression to a comatose state. So like maybe a really bad headache, some sensitivity to light, and then seizures and somnolence or inability to arouse someone. Which we use liposomal amphotericin B now because it is much better for toxicity side effects, because amphotericin causes a lot of renal and liver failure. So we use that plus a drug called miltefosine, which was actually designed to treat leishmania in Latin America, where it was really difficult to secure amphotericin.
Thank you for watching today's video, and I hope you were able to learn something about me comparing and contrasting the different parasites in both Oregon and Texas.